options they can offer. I would say it shouldn't be a huge problem. Most of these are quite easily available nowadays in the market. The second question, it's a retrace type sheath. I haven't come across that. Dr. Gregory, if you could just maybe elaborate what the retrace type sheath is in there, that'd be much appreciated. I'll just move on to the next question in the meantime. So from Dr. Arnold, yes. So in terms of the lasers, okay, so when we first started, so in my center, we had the Holmium, a high power, which is a luminous Moses, and we then subsequently had the TFL. So because I do enucleation and we have enucleationists as well, we wanted to preserve the high power Holmium, and therefore we actually tried to do most of our RIRSs with TFL. However, the problem with TFL is that the peak power is not high. And if you look at it in a wave, the TFL is actually like a very flat, low peak power kind of energy. And compared to Holmium, whereby you actually have high pulses. But the traditional problems with Holmium was that there was increased retropulsion in there. So now, the other thing that we actually use is actually the magneto laser. So the magneto laser, you can think of it as a really super power TFL. So it uses Holmium technology. So the total peak power can be very high. But because it's pulse modulated, there are no peaks in the high, like a high ridge. So the peak power actually starts like that and it goes here. So the magneto, for example, nowadays is very good in terms of the fragmentation, in terms of dusting, and it behaves like a very, very strong TFL in that sense. If you don't have access to the magneto, so for example, I actually trained some time in Guangzhou as well, in China, and when I went there, I actually changed my practice a little bit to become more of a fragmenter, because over there in Prof. Zeng Kuo Ha's unit, they only use Holmium, and actually you really have to consider how hard your stone is and whether extraction and suction is actually more efficient than trying to dust. So for me nowadays, on a practical sense, if the stones are hard, so say more than 900 and above, okay, I would tend to ask for a Holmium technology, because I'm able to fragment it better and then to get the extraction going. If it's a softer stone, maybe 4 to 600, 4 to 700, if you have a TFL, then yes, it might still be quite useful. So I would say play with what you have. Not all of us may have access to so many lasers, so know what you have and vary your technique accordingly. But I acknowledge that for very hard stones, just purely dusting with TFL can be a challenge, right? Okay, so I think I kind of answered the second part of that question. So we have different lasers, but again, the lasers are like a lightsaber. So Star Wars Day just passed, huh? May the Force. So it's really like a laser. How you want to kill your enemy really depends on how you move on the stone, how you vary your fragmentation strategy, and how you set your settings. So stay within safe limits. So we know that, for example, total wattage shouldn't go above 20. And then as you gain more experience, have a feel of how the stone is breaking. And then during the case, intentionally try to vary your laser settings to gain, to try to make the most of the case to see how you can better adjust your setting for that case and for subsequent cases. Right? Okay, so the next question is actually from Taiwan, Dr. Kuo. So this is about dusting. Okay, so in terms of dusting, so like when I started out, Dr. Vinit also told me use the TFL and try to dust as best as you can. But I really got frustrated with the very hard stones. Okay, so I would say that yes, if you can achieve very fine dust, that's all well and good. That's the perfect scenario. But sometimes it's really quite tedious to really hover there and really achieve really fine dust. And for Dr. Kuo, I think what you mentioned is actually those small particles that actually don't really flow around your sheath, don't flow around your scope. So those are actually the true dust. But those that actually still stay within there, you can actually visually see. Theoretically, I wouldn't really call it true dust because by right, true dust should actually flow around your scope and be evacuated. Those I would say are really small fragments, kind of 1 to 2 millimeter fragments. And I would say that I would generally still intentionally try to evacuate all of them. And because we do post-op day one CTs, and here we also personally, I feel that if I leave dust in there and if there's blood and it forms a coagulum, the chances of stone recurrence is actually higher. So for me, I actually completely evacuate even all the dust by using the tip of the fans to actually rub off some of these dust that's actually layers on the collecting system. All right. So I would say in the era of fans, generally what you can see, try to clear. Of course, if it's a very long case and you know you're quite sure that it's really just dust remaining, then yes, maybe leave the stand for a bit longer and let it pass. Okay. And it's a coloplast stent. Okay, so okay, so sorry, I'm not really sure about the stand, so I can't really answer that, Gregory. So I would love to get in touch with you on email and then we can explore this further. All right. Okay. Um uh Mr. Nava, Dr. Nava actually asked, do you use fans only on pre-stented patients? The answer is no. We use fans for every single patient. So back into it, since 2023, we've used fans 100%. That once you go to fans, there's really no reason to use a traditional sheath anymore, because the benefits are there. It's clear for everyone to see. So we change all to fans. Right? Okay. And in terms of the safety, it is safe. So but of course, it comes with experience. I must acknowledge that. So I work across 3 hospitals actually, and with some of my, I'm very privileged to have worked with Dr. Vinny to glean all these tips. But some of my colleagues who are actually starting out on the learning curve, they've actually run into some certain sepsis cases and certain problems. So I would say, as one starts out, just be cognizant of safety. These webinars hopefully do help, and do get in touch for some tips and tricks if it does aid in your learning curve. Right? Okay, the questions are coming fast and furious, so I'll try to answer as much as I can. Um, there's no clear maximum pressure in terms of irrigation and suction that we can set. Like I said, start off generally with a certain setting. You can use my setting, for example, and then like the chart I showed earlier, understand what is affecting your suction and irrigation. So for example, if you see that the collecting system is collapsing, then it could be, am I using a scope that is too narrow for my sheath? Or am I using irrigation that's actually too low? The setting is too low, or my suction pressure is too high. And from there, as long as you're adjusting within safe limits, you can actually play around with it and then see what subsequently works. Yeah. So I would say that unfortunately, I would love to have an answer for myself. What's the ideal setting? But I can't. We don't have that at this point in time. All right. Okay. In certain cases, in terms of using a larger sheath and scope. So I must admit that when I first got my hands on the Innovex sheath, I was greedy. I said, okay, I'm going to use the largest sheath so that I can get the largest fragments out. But like I said, it doesn't work that way, because when we use the largest sheath, it actually starts to compromise on our deflection. It can also compromise on the distensibility of the collecting system because there's too much space around the sheath, around the scope, and the system collapses. And it also affects me going down to the lower pole, for example. So generally, I don't really use a larger sheet unless, so for example, if you're using a 7.5, I usually use a 10/12. But if let's say you want to improve your efficiency a little bit, and if it's, let's say, a very clear-cut upper pole stone that you don't need too much deflection to the lower pole, and you're not too concerned about loss of deflection, then yes, maybe you can use 11/13. But in those cases, I would caution to up your irrigation pressure a little bit so that your distension remains. All right. Okay. My opinion about the Innovex versus Busan, I think I've showed that in that study quite clearly. It is there. So I'm happy, and I would love to get in contact via email, and I can send you some of those pictures if you're keen. All right. Okay. Using fans with a manual pump. Okay, so yes, we've had after doing this guide, we've had questions from all over the world about pressurized pumps, hand pumps, and gravity. So, in terms of gravity, I would say it's quite challenging to do fans because you really need to make sure that there's no pressure. Essentially, you cannot set pressure apart from varying the height, and there's a maximum that you can go to, and you can't really fix the flow rate as well. So in those cases, it can be hard. I would say at least try to use a pressurized bag. And even on the pressurized bag, so for example, I think the Canadians use the pressurized bags quite a bit. The problem is that once the pressurized bag kind of empties at least half, it's very hard to achieve that same pressure because it's not transmitted the same way. So those are more challenging. You probably towards the end of the life of that bag have to up the pressure even more to achieve the same setting. All right. Okay. I use fans 100% of the time as a fans. I don't believe in using fans as a conventional access sheath. That doesn't make sense. Some of my colleagues do that. Some of my juniors tell me, but it really doesn't make sense because if you have the fans as which is there, why is there a reason to not use the suction? Because of all the benefits that we've proven, reducing heat, pressure, as well as improving vision, as well as stone extraction, amongst others. So I really don't use fans without the connecting of the suction. Yeah. And in fact, at least in this part of the world, I know it can vary from different in different areas, but nowadays all our fan sheaths are cheaper than our conventional sheaths. So the argument maybe 2 years ago that it's more expensive doesn't hold. There's really no reason for us to use a conventional sheath or use fans as a conventional sheath anymore. Okay, so yeah, that was quite a quick fire Q&A. And I really appreciate the questions, and I'm happy for the discussion that's generated. And again, apologies that I had to rush through towards the latter part. Okay, everyone, one last question maybe from James. So, do I worry about excessive suction? The answer is no, because even if there is collapsing of the collecting system, there is no big problem with that. So one of the things that I'm actually currently studying is also what I call tip occlusion. So if you think about it as a column, when the tip of the fans is actually occluding the mucosa, it actually causes a closed system. And for me, anecdotally, that has actually helped me in terms of my extraction because there is more suction pressure that's actually generated when I close the system. So even if the tip is actually collapsing and it's flush now to the fans, it doesn't matter. There's no injury or harm that's going to happen. All right. Okay. All right. So maybe one of the feedback we can give Innovex is that the next round we'll try to extend the length of the the webinar so that I can try to address as many questions as possible. Okay. So I'm just going to put up my email one more time over here, and these are the ways to get connected. I'm happy to be reached out on LinkedIn. Do feel free to just message me or add me, and as well as my email that's over here. All right. Okay. So with that, I think thank you very much. Good evening, good day, good morning to you wherever you are, and we look forward to the next time that we can meet either physically or virtually. Thank you very much.